HPV is mainly gotten through sex.
Okay.
And when we are talking about sex, not just penetrative sex.
Okay.
So any form of sexual contact even. So talk of just the brushing or just the licking or even the pubic areas brushing against each other. If the partner has the HPV, it's possible you can give it to the person. So it's not just penetrative sex that can make you get the HPV. Okay, so that's actually the whole scary bit about getting HPV.
This is interesting. Hello everybody, welcome back to Midwife Adzo. Today we are the reproductive health department of the Kollebu Teaching Hospital, and we are very fortunate to have a conversation with Madam Frederica Cranche. So we would want to hear from her. Maybe she would want to give us a little gist about what she does here, then we'll pick up the conversation. Thank you so much for giving us the opportunity.
You're welcome. I'm glad to be on your show today. Okay, so just a little introduction. Like you said, Frederica, that's my name, Frederica Cranche, and I'm a senior midwife at the Reproductive Health Unit. And we do everything reproductive health, including cervical cancer screening, which is one of the major things that we want to work with. So we are doing a lot of the campaigns and a lot of outreach on the cervical cancer to be able to increase the awareness.
Okay, so in this video, as she started the conversation already, we'll be talking more about cervical cancer, and at the end of the video, it would interest you to know 3 things they are doing this year for you. You need to stick around and watch the video till we end so that you would get to know what really you need to do this year in terms of cervical cancer screening. Okay, so we want to start the conversation, and to start with, I don't know, most people will be wondering, what really is the cervix? Is the cervix that important in reproductive health? What's the cervix?
Okay, so the cervix is like the neck of the womb, or the opening into the womb.
Okay.
If a woman puts her finger in her vagina, high up in the vagina, it feels a bit like the tip of the nose. It protrudes in the vagina. So this is how the uterus looks like. For someone who's not pregnant, this is how the uterus looks like. So that's the cervix. So you see the cervix, or you feel the cervix when you put your finger in your vagina. And when we open up the vagina, we also see the cervix looking like this. So that is the cervix, and this is where we get the cancer that we are going to talk about from.
Okay, please, you are not supposed to be putting your hands into your vagina sincerely. You know, it's not healthy to put your hands into your vagina. This is for health or for educational purposes. That's why we are telling you that that's what you feel. That's what is felt when, so like, if mistakenly, I don't know what will let your hands find.
No, when you decide to go look for the cervix.
What will make you go and look for the cervix?
Right now we are talking about finding the cervix and how the cervix feels like.
Yeah.
So it's okay to, just for once, wash your hand very well, squat, and then put the middle finger in your vagina and feel the cervix. At least this is about getting to know your body. Okay, so it's fine.
So maybe just once, please take note, just once. Okay, so now we've now gotten an idea of what the cervix is. Now, what really is cervical cancer? Can the cervix also be cancerous? You know, there are a lot of parts of our body that end up, they say, oh, this person has prostate cancer, the person has a breast cancer. What is cervical cancer?
Okay, so just like you rightly said, we can have cancer of every part of the body. And we name the cancer based on where the cancer starts from, on the part of the body. This is cancer that starts at the cervix. So it's called cervical cancer, or cancer of the cervix. Naturally, the cells at the cervix grow, they multiply. But when it gets to a point where something influences the growth of the cells or the size of the cells, we say that we have cancer cells forming in. And it tends to destroy the normal cells at the cervix. And it eats into other parts of the body where the normal cells are growing to destroy all those normal cells in the other parts of the body. Okay. Cervical cancer is caused by a virus. talking, this virus is sexually transmitted. And it's the virus that causes the changes at the cervix that goes in to destroy the normal cells at the cervix.
Wow, talking about sexually transmitted, it means that, so this brings us to the causes, okay? Because she just told us that it's caused by a virus which is sexually transmitted. So what are some, apart from the sexual way, is it the only way? What are some of the causes of cervical cancer?
So HPV is mainly gotten through sex.
Okay.
And when we are talking about sex, not just penetrative sex.
Okay.
So any form of sexual contact even. So talk of just the brushing or just the licking or even the pubic areas brushing against each other. If the partner has the HPV, it's possible you can give it to the person. So it's not just penetrative sex that can make you get the HPV. Okay, so that's actually the whole scary bit about getting HPV.
This is interesting. Please,
Yes.
I'm sorry to, let me just, this is very interesting. So, so HPV is just human papilloma virus. Yes. I just want to bring that to your attention, okay? It's not in a big word, okay? We're just making it, we're just making it easier. That's why she's making it HPV, okay? Yes. So like, hey, this is scary because, so how will you know that you are having this then if, because you just said that just the brushing, just like,
so before we go into how you know you have it,
yes,
there are a few other things that can put you at risk of getting it. So I said the sexual contact. So when a lady starts having sex early, she puts herself at risk of getting the HPV. That's one.
Wow.
When a lady has had multiple sexual partners, she also puts herself at risk of getting HPV. If a lady has been with a man who has also had a lot of sexual partners, it also increases the lady's risk of getting the HPV. Okay, so we are still talking about the whole sexual contact thing or the whole sex being the major cause. So all this puts the woman at risk, right? We also have instances where people have or women have very low immunities.
Okay.
Very low immunities actually predispose you to getting a lot of different types of the diseases or the infections or whatever, including HPV. And also when someone gets HPV, just like every other viral infection, the body's immunity is able to clear the virus. So if it happens that you have the HPV and your immunity is very low, your body won't be able to clear the virus, which should also mean that it makes it easier for the virus to actually now take charge of the body and cause the cancer. But otherwise, the body is able to clear the virus when you have it.
Oh, so the body can clear the virus?
The body can clear the virus. So
it's an issue with immunity now.
Yes. So thankfully, not everyone who gets the virus will get cancer in the end.
Good news.
But that is when you have a very strong immunity. Okay. And when you don't keep exposing yourself to the virus. Let's say that you meet a man who has a lot of the virus or has the virus. You have sex with this man. Your body is able to clear. You go back. Your body is able to clear. There's something we call persistent infection. When you have persistent infection with the virus, it tends to stay.
Interesting.
Yes. When you have persistent infection with the virus, it stays. So then your body won't be able to clear it every time you get it, especially as you are growing. Because naturally, as we are growing, the immunity keeps dropping. It keeps dropping. So for a younger person, let's say a 20-year-old who gets the virus, we are not too worried about it than a 30-year-old who gets the virus. If you get the virus at 30, we are worried because it's not very likely that your body will be able to clear it, because at that stage your immunity has dropped compared to somebody who is like 18 or 20, because they will be able to clear it within a few months or years.
Now, how will I know that this man has HPV? Because we don't tend to, it's not written on their faces. We can't, like, how will we know? How do we go about this?
It's not even about whether the man has it, but you yourself, if you have the virus, you don't even know. So the virus doesn't cause symptoms for you to know that you have the virus, whether for the man or the woman. Okay. One thing about the virus is when you get the virus, it can stay at the cervix for about 15 to 20 years before it causes a cancer.
Wow.
So the virus can stay dormant at the cervix for about 15 to 20 years. But during that 15 to 20 years, it's not just dormant. It is causing abnormal changes at the cervix, which are gradual. Okay, so the changes go on over a long period of time, which still doesn't give any symptoms. So you have the virus, it's causing changes at the cervix, but it's not showing any symptoms. So you don't even know you have it. So even you won't know you have it. For you to tell whether this man gave it to me or that man gave it to me, you won't know.
Interesting.
But the virus is there.
Interesting.
You understand?
Yeah.
So when the virus has been there for a very long time without showing any symptoms, and nothing has been done about the abnormal changes that is being shown, that is when it develops into a full-blown cancer.
Okay.
Do you understand?
Yes.
Yes. So before it gets to a full-blown cancer, the virus would have been there for so many years without you even knowing that you had it. If your immunity is low, it makes it easier, or the changes go quicker than for somebody who actually has a strong immunity. So when your immunity is low, as it would take for somebody who has a stronger immunity about 15 to 20 years, if your immunity is very low, maybe you have some medical condition or HIV, which actually brings your immune system down, it can take you about 5 to 10 years for you to get to a full-blown cancer.
Oh, okay.
So that's like half the time it will take for somebody who has a much stronger immune system. Okay. So when we are talking about cervical cancer, the kind of changes that we are looking for before the cancer even develops, I have this one to show. So this is what a normal cervix looks like. So just like I'm showing you here, when we open up the vagina to look at the cervix, you see something like this. This is especially for someone who has never delivered before. Okay, but after delivery it tends to open up a bit, so we have some of these changes which indicates what a normal cervix should look like. These are some changes that occurs at the cervix, but it's not HPV related. Maybe some kind of infection, bacterial vaginosis, or some abnormal growth, but it's not HPV related. But when you have the virus, the HPV, we tend to see changes like this. This is like a few of the changes that we see. They're actually a bit more, but these are a few of the changes that we tend to see. A lot of the time, even during this stage, there aren't any symptoms that show. Okay, but when nothing is done about it at this stage, then it goes to a full-blown cancer. And at that point, it's actually very difficult for us to be able to do anything about it for the woman. So we don't want it to get to this stage before we even seek treatment. So to talk about the signs and symptoms, the signs and symptoms only come in when the cancer has started.
Wow.
So during the whole 15 to 20 year period when the changes are going on, there are no symptoms. So you only have the symptoms when the cancer has developed. And that's when the woman will have severe bleeding, severe pain during sex. She can have bleeding during sex as well. She can have very abnormal vaginal bleeding, like the menses just stopped, then within a few weeks or a few days, she's bleeding again. She can bleed continuously for like 2 weeks, 3 weeks. It stops and within a few days, she's bleeding again. Sometimes they see it like that, even though they know that this is not normal, but they still don't see it as a problem to go to the hospital with. But that actually means that it's possible that cancer has started. Okay. For our older women who have reached menopause, you got to menopause about 2, 3 years or 5 years ago, and all of a sudden you start bleeding again. That's not normal. You need to go to the hospital. Okay. And then some people also tend to have very, very offensive vaginal discharge. Very offensive. It smells like rotting fish or rotting meat. It's that bad. Some people will have issues like this, and all they start thinking about is, I'm having whites. I'm having what? They go to pharmacies, they take all the treatments, it doesn't work. Then they start doing herbal medications, it doesn't work. By the time they realize that, okay, no, let me take it to the hospital, it's already too late. Because when the cancer starts, within a few months, it spreads. Unlike when the changes are there for years, the cancer itself, within a few months, it has spread beyond the cervix, even through the uterus to other parts of the body. So by the time they already comes to the hospital, it's too late.
So how would someone know that they are at risk of this? So what can I do to, like, for the early stages to be able to know if I am at risk of having a cancer? What can I do? Like, what will I do to know that I am at risk of having a cancer?
So talk about having the cancer. It's usually with the signs and symptoms that we look out for. But like I said, we always want to catch it early before the cancer develops.
Okay.
So for you to know whether you're at risk of getting it, there's a test we call a pap smear.
Okay.
Okay. A pap smear is the test that we do to check the cervix for any abnormal changes.
Okay.
We do the pap smear because we want to be able to catch the changes even before it gets to the stage where it's shown here. So we do the test early. We are supposed to be doing the test every 2 to 3 years. So far as we are still having sex, we need to be doing the test regularly.
Let me repeat that part again. Every 2 to 3 years,
Yes.
you need to do a pap smear if you are sexually active. Okay, so now, like, is pap smear expensive?
So currently here in Kolebu, as part of the campaign, like I mentioned in the beginning, we have reduced our cost for a pap smear.
Okay.
To be able to allow a lot of women to engage in the screening.
Okay.
Okay. So the pap was 170. Now it's been brought down to 100 cedis.
Okay.
Okay. And then we have another test where that we call the HPV testing. The HPV is where we are looking for the virus itself.
Okay.
We mentioned earlier that the cervical cancer is caused by HPV. So we can do the test to check if you have the virus and also if you have the changes there or not. So that's a 2-in-1 test. It used to be 320, now it's going for 220.
Okay, 100 cedis out.
Exactly.
Okay.
So we are doing this for a period of time. We started in the first week in February. We are doing it up to like, I think April. Yes. So we encourage a lot of people to come. But I would also want to point this out. In as much as the time slated for this is in April, we say the earlier the better, because we are working with some sort of funding. Unfortunately,
oh, really?
yes. And so far, we've had a lot of women come to do the test. So we are encouraging as many women as possible to come and do the test so that we'll be able to cover the number that we have stipulated within the time frame for the screening. So it's either 100 cedis or 220. Yes.
Okay. Now, what are the treatment options if maybe I finally find myself doing a pap smear and you've been told that, oh, you have the cervical cancer, or it's like you are at risk, or maybe your cervix, we can't do anything about it again? What are the treatment options?
Okay,
now?
so treatment depends on at what stage of the cancer that we see.
Okay.
All right. So treatment usually starts from when we are dealing with the abnormal changes first. Okay. The abnormal changes is called pre-cancer cells because it hasn't exactly become cancer yet. That's where we start the treatment from. So sometimes when we see the changes there at the cervix, it's either we are taking the part where the abnormal changes, we are just scraping it off to get the abnormal cells off. New normal cells are going to grow there. So the cervix becomes healthy again. There are times where we'll have to take out the whole cervix because maybe the changes are extensive, and if we don't take it out, it will spread. If it's actually the cancer, it depends on the stage of the cancer. We have stage 1, stage 2, stage 3, stage 4. Each stage determines how far the cancer has spread. So when we see how far the cancer has spread, then we know whether we are taking out the whole cervix or the whole uterus with the cervix, or we are doing chemotherapy, we are doing radiotherapy. So there are different forms of treatment depending on at what stage of the cancer that we see. But we always want to catch it before it gets to cancer.
It's perhaps more painful because I know in someone's mind, the person's like, hey, you want us to come and go through some procedure that is painful. You want us to come and scream, and they'll come and say, keep quiet, we don't scream here. Please, like, how is it like? Is painful?
So no, pap smear, I can assure you, it's not painful.
Okay.
Okay, I have done it a couple of times.
Oh, okay. I will.
So pap smear is not painful.
Okay.
It can be a bit uncomfortable.
Okay.
You see, initially I described that the cervix is high up in the vagina.
Yeah.
And we are taking the cells at the cervix. Okay. So what we need to do is to open up the vagina a bit to be able to see the cervix.
Okay.
We use this plastic device we call a speculum.
People don't like this speculum.
Okay, so for a pap smear, we usually prefer to do the plastic one.
Okay.
It's less uncomfortable.
Okay.
Okay. And it's not the whole thing that goes in. It's just the tip here that goes in. And we are going in till we're able to see the cervix. So we pass the speculum. We just open it up a little till we're able to see the cervix. So we are not opening all the way like this for it to get scary. No. It's just a little like this. Okay. And when we're able to see the cervix, we use this brush. Feel it?
Soft.
It's a very soft brush, exactly. So all we do is just clean the cervix. That's all we are doing.
I've done a pap smear test for someone before.
So so did the person express pain?
No, the person didn't express pain.
Okay.
The person didn't.
So it's actually just simple. We are just cleaning the cervix with this brush, very soft brush. It goes into this bottle that has what we call a fixative.
Okay.
So it's more like a preservative of the cells. So we put it in the cells, in the liquid. It goes to the lab. They're able to pick the cells from the liquid to run the test on it to tell if there are any abnormal changes in it.
Okay.
But a pap smear is not painful.
Okay.
The only bit about it is it's uncomfortable because we are putting something inside your vagina. But it's not painful. Not at all. But if you are actually thinking about whether it will be painful for a procedure that will take less than 2 minutes, please think about what will happen when you actually have cancer.
Yeah.
And you have to go through chemotherapy and surgery and all that. Which one is better?
We'll go to the easy one.
This is a 2-minute something.
I know.
Than a lifetime of pain you would have to go through.
It's true.
You understand?
Yeah.
So sometimes you're actually weighing options. Which is better? It's just a 2-minute procedure.
Oh, thank you so much. So we want you to tell us what you are doing. So you are doing 3 things. I think we need to get tested, get treatment, and get what?
Vaccinated.
Get vaccinated. So let's talk about those 3 things.
Okay.
Talking about the vaccine, I'm so interested in the vaccine. So just give us the one. Down.
We want to encourage everyone to get vaccinated. The vaccination is one of the preventive methods.
Okay.
Or preventive measures. So for somebody who has never been exposed sexually, somebody who has never had any kind of sexual contact, no brushing.
Repeat that part. Any kind of sexual contact.
No licking. No.
Nothing.
I mean, we don't want the whole pubic area or the whole, how do you call it? The reproductive organs to even come close to each other.
Okay.
So if you haven't had any kind of sexual contact, no licking, no nothing, you can go ahead and do the vaccination.
Okay.
Vaccination works best for those between 9 years and 26 years.
Please, let's take note. 9 years and 26
9 years up to 26 years.
Okay.
Vaccination works best.
Okay.
So from between 9 years up to 14 years, they need 2 injections.
Okay.
From 15 years up to 26, they need 3 injections.
That's like 5.
No.
Okay. Okay.
That's it for life.
Oh.
If you are between 9 and 14, when you get your 2 injections, it protects you for life, and that's it. But
they should have told us this
if you're
earlier.
coming to take the injection and you're between 15 to 26, you take 3 injections within a 6 months period.
Okay.
It also protects you for life.
Okay.
But that being said, we don't want to take anybody else out who is willing to take the vaccination. So if you are older, or if you have had sex before, even if you are not 26 years and you have had sex before, we do an HPV testing to be sure you don't have the virus first.
Okay.
Before we give you the vaccination.
Oh, okay.
So for those virgins between 9 and 26, they take the vaccine without the testing. But those who have had sex, even if it is just once your whole life, even if it was the one-time brushing your whole life about 10 years ago, you still need to do an HPV testing to be sure you don't have the virus before we give you the vaccination.
Okay.
Okay. So we can take the vaccine up till maybe 40 or something, but we need to be sure you don't have the virus before we go ahead and give you the vaccination.
Is the vaccine expensive?
Unfortunately, the vaccination is expensive. Okay. Currently, the vaccination is $750 per shot. Yes, $750. It's quite expensive, but so that's why we're actually encouraging the younger ones rather to take it than those of us who have already started having sex since I mean, for somebody who is older than 26 or somebody who has already started having sex, they don't even get full protection from the vaccination. They get only about 70% protection.
Oh.
Okay, so for those who are still virgins up to 26, they get the full 100% protection. So they are the ones who need it more than those who have already started. So even if you are 23, you started having sex, you don't get full protection because you've already exposed yourself.
Yeah.
You understand? So we do the screening. You don't have, we can still give you the vaccination if you want, but you still need to be doing the test every 5 years.
Okay. Wow. Wow.
Yes.
So we've talked about the vaccine. We've talked about the testing, which is doing the HPV and the pap smear, and we've talked about
the treatment. So the treatments, yes, that's what we mentioned. So what I also encourage is that if anybody notices any of the signs and symptoms I mentioned, please just it's not every time that you have pain during sex or bleeding during sex or abnormal bleeding that you assume you have cervical cancer. There are other things that can cause all of that. But as soon as you start seeing those things, the best option is to go to the hospital, let a doctor see you, or have a pap smear done to rule out cervical cancer before you can decide to relax at home, because it might actually be cancer. Okay, so that we can start the treatment from there. You understand?
Oh, thank you so much. I believe you've learned some things from this video. You want to share your comments, you want to ask your questions, and you would get the answer. Thank you so much for watching. Keep watching. Thank you so much for the time. I really appreciate it. Have a blessed time, everybody. Bye.